Assalamualaikum and salam sejahtera. This is the final part of the management of ergonomic issues based on workstation design principles. Previously, we covered how we can manage ergonomic issues based on workstation design principles, including how to design the workstation components correctly. In this presentation, we will continue on the same topic. This is a recap of the critical components of a computer workstation. We have previously covered chair and desk aspects. Next, we need to consider the monitor. An improper placement of the monitor will result in the computer user either attempting to lean back or forward to view the monitor, which may lead to neck and back strain. The monitor should be positioned directly in front of the user at a distance of an arm's length, with the top of the monitor either at or slightly below the eye level. The angle should also be adjusted to prevent glare from the light source. To further reduce eye strain, the 20-20-20 rule can be applied, where computer users can look away from the monitor every 20 minutes at an object that is about 20 feet away for a full 20 seconds. As shown in the diagram, the height of the monitor should be placed at the eye level to maintain a comfortable working position. The monitor should also be placed to the side or below a bright light source, not directly in front or behind it. It should also be placed more than 2 meters from the windows to prevent glare. To further reduce glare, a few options are available. One is to reduce the amount of overhead lighting. Second is to install indirect lighting to direct lights towards the ceiling so that light can be increased without introducing glare. Third is to install parabolic louvers for fluorescent lights to reduce brightness and glare of bulbs and distribute lighting evenly. Fourth, louvered blinds and tinted window films can be installed to reduce brightness and minimize glare. A practical way to minimize glare is to adjust the overhead lighting to a lower comfortable level and adding a desk lamp to provide more illumination where needed, as in task lighting. There should be a maximum ratio of 1:3 between the brightness of the computer screen and its immediate surroundings. Finally, if glare is still present, glare-reducing filters on computer screens or anti-glare glasses can be used. Next, the keyboard and mouse. An improper keyboard and mouse position can lead to sustained shoulder elevation, wrist extension, and shoulder and neck loading, which may cause injuries. As shown in the diagram, the keyboard tray should be adjusted so that the wrist is straight. The body should be centered so that the computer user is aligned with both the keyboard and the mouse. And finally, place the mouse as close as possible to the keyboard to avoid rotating the shoulder. When using the mouse, the wrist should be kept neutral and straight to prevent prolonged extension and flexion of the wrist and ulnar and radial deviations. Use a thin keyboard to reduce wrist extension and adjust the slope of the keyboard via a keyboard tilt so that the wrists are not held in extension during mousing or keying. In addition, keyboards that do not have the numeric keypad, such as mini keyboards, can also be used to reduce shoulder, external rotation, and reach to the mouse. Keyboard shortcuts can also be used for frequently used commands for the same reason. Other options include fixed split keyboards, which are keyboards with separation and tilt between the two halves. This type of keyboard can be used to reduce wrist ulnar deviation and forearm pronation. For computer users with pain in their mousing hand, provide several very different types of pointing devices and have the computer user alternate between them on a weekly basis. There are various types of pointing device besides the mouse. This includes touchscreen, touchpad, trackball, pen, joystick, and pointing stick. Next, if the work involves frequent click and drag, the computer user can use a mouse or any type of pointing device with each hand, one to hold the button down and the other to move the cursor. This is to reduce upper extremity strain. If elevated forearm supports are used, use one or more mouse pads to place under a thin keyboard or mouse so that it is slightly raised and the wrist is kept straight. Next, if there are telephones, video, or web conferencing appliances used in the computer workstations, some measures can be taken to improve the ergonomics of the workstation. Computer users who frequently use the telephone can use a headset to allow for hands-free operation. This would eliminate cradling of the phone between the shoulder and the ear while writing and handling documents or using the computer, and this will avoid awkward postures. Finally, if a laptop is used in the computer workstation, a laptop stand can raise the laptop screen to a higher eye level. As mentioned earlier, the monitor should be at or slightly below eye level, and a laptop stand can be used to position the laptop to enable this. This will improve the computer user's neck posture while using laptops. After implementing the measures based on workstation design principles, some steps can be taken to assess and manage workers' workstation and related tasks. Firstly, the workers should be taught about good computer workstation design. Then they should be asked whether the current computer workstation design fits their work and comfort levels. They should also be observed as they are performing tasks to identify opportunities for improvements. Finally, when necessary, changes to the design of the computer workstation should be implemented to optimize its ergonomics. This may include quick, immediate changes such as monitor height and later on ergonomic design elements such as installing ergonomic chairs and desks. Tools that can be used to assess computer workstation design include Initial Era Checklist, ROSA, OSHA Computer Workstation Checklist, and anthropometry analysis. That is all for this presentation. Thank you for your attention.